we're seeing our partners in the States having their worlds upended. What it means for us is clinical trials may come to an end. The ability to have hope for, those clinical trials turning into treatments and cures is now being eroded. And so it's going to be our responsibility here in Canada to do as much as we can to fill that gap.
Hello, and welcome to Visionary Voices in Optometry, where we spotlight the changemakers shaping the future of eye health. In this series, we explore the intersection of leadership, technology, and the evolving landscape of eye health, highlighting how bold ideas are transforming patient care. I'm Mark Donnison, CEO of the Ontario Association of Optometrists. Today, I'm thrilled to be speaking with someone who's leading an organization at the forefront of vision research, patient support, and advocacy. Jennifer Jones, the CEO of Fighting Blindness Canada. We talk about strategy, her leadership journey, and advocacy in Ontario and across the country. So let's dive in. Hi, Jennifer.
Hi. Mark.
It's wonderful to have you here. Thank you so much for joining me today.
Thrilled to be here.
I'm so excited to have you, and I've been really looking forward to our conversation today, especially with all the great work that you've been doing in the sector and eye care and healthcare overall. So thank you very much for being here. Why don't we start off by having you share with us a little bit about yourself?
Me, about Jen Jones.
Yeah.
So I was born in Canada, in Montreal. I've been lucky to live in a lot of different cities across Canada. Toronto's been my home for a few decades. I spent some time in Asia working in several different countries in my 20s. And then I did my MBA at Ivy. And it's when I did my MBA that I started to find my career. And so from a professional standpoint, I started in marketing and communications and sponsorship. But my values had me start to lean more towards like corporate social responsibility. I ended up joining Indigo and I built their corporate foundation, which was focused on children's literacy, in particular in more vulnerable schools and communities. And then I moved from there and transformed the Toronto Public Library Foundation. And then I recently joined Fighting Blindness Canada as the president and CEO for a couple of reasons. One, my passion is for bringing my business acumen and my heart for making a difference in the world. So finding an organization that is looking for that was really important to me. But also, I had an uncle who had Usher syndrome. So he was born deaf and lost his eyesight over time to retinitis pigmentosa. And so the work that Fighting Blindness does is really, it's a beautiful blend of the head and the heart for me.
Wonderful. That's so inspiring. And it sounds like you found a nice spot for you, right?
Nice intersection of who I am personally and who I am professionally and what lights me up. And, when you go to bed at night, you feel like you've put your time into something that's meaningful.
Awesome. Thank you for sharing that with us. We're going to talk a little bit then about Fighting Blindness Canada. So tell us a little bit more about what the organization actually does.
Yeah. So for those who don't know Fighting Blindness Canada, it's been here for just over 50 years. And it focuses on supporting individuals who are losing their eyesight due to a blinding eye disease. So that's very key because it's what differentiates us from all the other vision health partners in Canada. We do that. We support that community by investing in the most promising world-class research to identify treatments and cures for eye diseases that lead to blindness. And then we take the knowledge that we're getting out of that science and those research relationships, and we bring it to our community. People who are living with a diagnosis, who maybe have a lot of questions about what's going on with their eye, what should they be anticipating over the next 5, 10, 20 years? What are the questions they should be asking their doctor? And then we also create community connections because a number of the families and individuals we support have inherited retinal diseases, which is a smaller group of individuals. And so someone in Vancouver who has just received a diagnosis may know nobody in that area. And so we're connecting them with people across the country. So we really focus on research, information, education, community connection, as well as advocacy, which is a key part of what we do.
Right. What is it that your organization is aiming to achieve over the next 5 years, let's say?
End of vision loss due to blinding eye disease. So we're very focused on that as our principal cause. And how we define that is right now there are 4 blinding eye diseases in Canada that are affecting the majority of the population are facing these 4 eye diseases. So inherited retinal diseases, which are a bundle of a lot of different eye diseases like Stargardt's and retinitis pigmentosa, for example. Then we have age-related macular degeneration, and that's a population that is really expanding because it's the boomers, right? And so we're seeing more and more people being diagnosed with AMD, and then glaucoma and diabetic retinopathy. So those are the key eye diseases that we focus on. We pump up different ones according to certain strategic priorities, and of course, what's happening in the marketplace. And right now, AMD is becoming a much more important part of the work that we're doing to support that audience.
May is recognized as Vision Health Month. Yep. So how does Fighting Blindness Canada participate in this awareness initiative? So
we, over the course of the year, we have, like I said, our education and community connection events. So through the part of through May, we are kind of just, the messaging becomes a little tighter around a lot of the prevention that what people can do to stay on top of eye health. Not everybody in Canada is aware of what you need to do to have eye health, and it starts with finding an eye doctor, finding an optometrist, getting in there and doing your regular checkups. There's tips around how to maintain your eye health as you age as well. And so we pepper those messages in around May. But again, those are activities that we do throughout the year. So it doesn't change a lot of what we do, but it does make sure that we are really elevating the message around the importance of vision health and how you can take care of that yourself.
Right. So how else does your organization go about educating Canadians on the importance of regular eye exams and proactive eye care?
Yeah. So we have, our website has really robust information on it. So that would be a first place to start. It is also around, we have what we call viewpoints, which are these events that we host throughout the year. Some are in person, a lot of them are virtual, and they can be very focused on eye disease specific content. So sometimes it's generic or more, we're bundling different eye diseases together depending on the issue at the time or what a common thread might be across those eye diseases. And then we also have a health information line that people might call if they're looking for specific information. So it's prevention, I would say, is probably a core message for all the vision health organizations. So regardless of who you're supporting or where you are on the spectrum of vision health care, it always starts with prevention. And in fact, one of the conversations I think we're going to have is around advocacy, and we can talk about the national eye care strategy, and that very much factors into that.
Right. Okay. So we're off to a great start. So we're now going to get a little bit more personal. Yeah. So let's talk a bit more about your experiences as a leader in vision care. Mm-hmm. So why don't we start with some of your most significant leadership experiences in the industry so far?
So first of all, I want to say to everyone who's watching this and you and your team, I came from really health and literacy and education for the last 15 years. So stepping into the healthcare and vision care space has been a real learning curve for me. And I am gobsmacked at how warm and welcoming people have been. It's been a really beautiful entrance into this new area. And I'm super curious and want to learn, and everyone has been giving me a lot of time. So I'm coming up on 2 years in this role in June. And one of the biggest achievements I've been able to be a part of is this collective with all the other large national vision health organizations. So we call ourselves the Vision Health Partners. We came together to get the new national eye care strategy across the finish line. And so I joined that, June 2023. We had it approved with royal assent in November of last year, which was a big deal. It's a big celebration for Canadians. And now we are continue to work together, this collective group, to help shape Healthcare Canada's development of the eye care strategy. So the work continues, and next May, we're hoping that when it's presented to whichever government is in place, there'll be an approval of the eye care strategy. And with that, unlocking some net new funding that will be dispersed across the different areas of the strategic plan. One of them is research. Right now, there is a relatively small amount of funding that goes into vision care research, and we want to see that grow.
And we were in the same building at the time when that celebration was happening, right, and launching it. So we didn't cross paths,
no,
though. But
thankfully, we
have
found
since
you,
then,
found me, we found each other, anyways.
Continuing on the personal level, so what challenges have you faced as a leader in this sector, and how did you overcome them?
So is that a timely question, Mark, with everything going on in the world? I would say so. From a very like more internal and selfish point of view, the way I would answer that is our organization has been around for 50 years, and the people who know us love us. We have loyal donors and loyal community members who really are looking to us to solve big issues that they face, which are these eye diseases that they might be passing down to the future children, parents who have already passed it down and are living with that and want to make sure that future children aren't affected. But we know that there's a lot of Canadians who could benefit from our expertise, the investment we make in research and the outcomes of that research and the community support that we provide. And not enough people know that we exist. And so one of the biggest challenges I face is how do we create more awareness of the work that we do and that we are there for people who on this healthcare journey, regardless of where they are in their diagnosis. We are someone that they should be able to turn to as a trusted partner. And so that is probably the biggest strategic challenge that I have right now. And so trying to do that, trying to find where people with vision loss are, communicate to them in a way that's meaningful to them, and also, be fiscally responsible in doing it, right? This isn't a scattershot approach. We have to be really intentional about where we put our resources. From a bigger picture standpoint, it's an interesting question because, of course, there's a lot of change that's happening down in the States. And I'll let you decide how much you want us to talk about that. But I will simply say that funding is being eroded quite quickly for healthcare research in the States. And that will have a domino effect on Canadian health and international health for decades to come. And so we're seeing our partners in the States having their worlds upended. What it means for us is clinical trials may come to an end. The ability to have hope for, those clinical trials turning into treatments and cures is now being eroded. And so it's going to be our responsibility here in Canada to do as much as we can to fill that gap. And right now, we don't have the funding to be able to do that, either from the feds or from our donors. So our donors have been, like I said, loyal and committed. But we're still relatively small in the Canadian landscape, even though we are the largest charitable funder of vision research in Canada. There's a lot of room for us to grow. And so that what's happening south of the border is actually a great opportunity for us to demonstrate that we are made in Canada. We are all about supporting Canadian research, still the most promising research, and we will still look internationally to make sure that happens. But it is also a chance to keep Canadian talent engaged and growing here in the domestic market. And so we're really doubling down on the message of we've always taken the long view, right? Research is very much a long game. What's happening elsewhere in the world is not changing our commitment to the community, how we invest in research, and how we bring those outcomes and that intelligence to our community.
So with the ever-changing world and the unpredictability and volatility of it, part of the need within organizations is to continue to innovate and improve continuously, right? So as a leader with the team, what do you do? What are some of the tips and tricks that you apply to foster
innovation
that
in
mindset?
that? Yeah, it's a little bit. I will say we're talking up until now. I've talked more about like what the organization does and the programming and the research and the expertise we'll have. For me, the way to set up an organization so it can continue to be innovative really goes back to culture. So it's about clear goal setting. It's about being very crystal clear about what our long-term, short-term goals are, how we're going to measure those, and then having the right talent on the team. And then it's about accountability and empowerment and collaboration. And if you can get those ingredients all mixed up together, then I think innovation comes out of that. You have to have a safe place for people to take risks and to be able to fail and learn and move on more as quickly as you can. And so my job is to make sure that Fighting Blindness Canada has the culture and the people and the resources to be able to invest in innovation. And so because we've actually always been investing in the most innovative research, it doesn't change that. More what we're focusing on right now is how do we identify untapped opportunities with a new talent base that I've been able to attract to the organization? And how do we really celebrate the wins we've had over 50 years, demonstrate the value of the impact that we've had on Canadians, and amplify that over time? That's more where our innovation is being able to think creatively and strategically and financially responsibly, right? We have to be very thoughtful about where we put our energy and time.
So you're a couple of years in now.
Mm-hmm.
What has you excited about the future?
Because even though we've been here for 50 years, there's so much room for potential. Like, we know there are millions of Canadians right now who are living with vision loss at different degrees. But we're not talking to those millions of people. We're talking to a much smaller subset of people who know us. So I think we have a responsibility to be able to reach as many people as possible. And so there's a huge amount of runway for us to be able to consider how to do that and do it effectively and do it sustainably over time. That's exciting. When this viewpoint event that I mentioned earlier, we had one in Toronto back in the fall. It was a half-day session. Families came from all over the GTA. And I sat down at a table with this family who had two adult sons. One has started to lose his eyesight to a recent diagnosis. And it turns out the elder son is probably going to be diagnosed with the same blinding eye disease. So this family is sitting there saying, like, we don't understand anything about this. We weren't prepared for this. We don't know what questions to ask or what it means for my child's future. Will they be able to continue to work? They're independent now. Will they be able to maintain that independence? And the only reason they were there is because they Googled the right words and they found us. That is not how people should be Fighting Blindness Canada at a time of diagnosis. Right? There really should be a stronger connection between, I think, the healthcare providers and the work we're doing, so that there's a smoother handoff or introduction at a time when we know that when you're given a diagnosis, you can't hear more, right? You need to take it away. You need to sit on it. You need to get ready to have the emotional conversations. And when they're ready, we want to be a trusted advisor that they can turn to. But we need other people's help for those patients to find us. And so that's exciting. For me, that's a meaningful way to put my time and expertise, into the world. And that's one example of what we're doing, of how we're doing it.
Right. Awesome. Sort of on a similar track here, one of the dynamics that we see with eye care is that it's often not top of mind with people. Mm-hmm. So everyone's really busy, they're preoccupied, kids, ailing parents, so lots of things, right? Yeah. Life, right? Yeah. And so people don't think about going to get their eyes checked. So they, oftentimes you'll hear people say, well, I can see just fine, so I have other things I have to deal with, right? And so in that, and we also know that there are hundreds, you know more than many people, that there are hundreds of conditions that can affect our vision. And the onset of many of them are asymptomatic, so that they don't present anything right early on. Right. So these conditions start, and oftentimes by the time we do see symptoms, it's almost too late, mm-hmm. or it makes their conditions more complex, difficult to treat. And it's a difficult piece of news to share with people, right? As you're saying. And then in worst cases, people are losing their vision before anything can be done, right? So many of us work to build this public awareness, mm-hmm. and about the importance of eye care and advocate for improvements in patient care in our health system. So let's talk about what your organization does to advocate for improvements.
It's a question that I think our organization would have been able to talk to for decades, but it's a really interesting time because of the recent passing of the National Eye Care Strategy. So when I joined Fighting Blindness Canada, I didn't appreciate the gap in exactly what you're saying, in Canadians' understanding of how to take care of their eyes and the importance of regular eye checkups. But when I started to reflect on my life, separate from my uncle's experience, I remember being like a teenager and someone showing up with glasses one day at high school and saying, yeah, it turns out I'm not dumb. I just couldn't see the blackboard, right? How many times did I hear that from people well into their 20s? And at the time, I always thought that was bonkers because my mom was one of those people who was like, every 6 months you're having your teeth checked, every year you're going for your eye check. Like my mom was on top of that stuff. And I made the assumption that everyone had a mom as vigilant as mine. And so all those kind of stories has been coming back to me now that I'm in this role. And what we're hearing from our community, even that call in during these viewpoint seminars or the episodes that we host, is there's a real inconsistent application of the understanding of eye health across Canada. And it's not necessarily rural versus urban or anything to do with socioeconomics. It's just there is a confusion, I think, in the marketplace, if you will, of what is important and how you can advocate for yourself. Some of it is because provincially there are different regulations, right? And so being able to participate in that Health Vision Partner Collective was really satisfying for Fighting Blindness Canada. We were one of 6 organizations that were working very collaboratively with an MP who took this on as her cause of choice. And over the course of, a couple of years, we met with senators, we met with other MPs, and we were able to make a very smart, economic, and also human-centric case for why having a national eye care strategy in Canada is important. I would also stop there and for a moment say to anyone who's watching, as a kid, we went to school, right? And a lot of people probably remember this. And the dentist would come into our classroom and you would chew on that pink pill. And then when you smiled, it showed where it would grip onto the plaque of your teeth. And so it would show you where it was. And then you would brush your teeth. They'd give you a brand new toothbrush. And then you do the pink pill again. And it would show how important proper teeth maintenance was. We don't have anything like that in the in the educational system across Canada. So there's a lot of work to be done to explain to Canadians why regular checkups are important. So accessibility, prevention is one of the pillars of the National Eye Care Strategy, but accessibility is as well. I'm sure a lot of people who are listening to this understand that there aren't enough, eye doctors, whether of the O's, ophthalmologists and optometrists in Canada to be able to serve the market. And being able to, if you're in more remote communities, it makes it even harder. So making sure there's enough doctors to serve patients is something that we're also having to address. And so there's the prevention, there's the education, there's accessibility, and then there's the research. Research like we do it, innovative research to address treatments and cures, but there's also rehab research. So people who have been maybe in an accident or had a stroke and are having to rehab out of that circumstance, there's research around that as well. And so those are the elements of the National Eye Care Strategy. Like I said, we are continuing to work together to help develop the strategy because we just got what was passed was the permission to develop the strategy. And now that's the phase that we're working in. And that'll be a huge deal. That'll be a legacy for all the organizations that are part of that conversation.
When you think about the long-term outcomes of this, how would you measure the success or the changes, right, that we want to see happen?
Yeah. So at a macro level, we haven't identified that yet. That'll be part of the strategic planning discussion, and we're at the very early stages of that. I would say would probably be looking for like the number of people who are finding an eye doctor and signing up for their first eye exam, et cetera. So there probably will be macro metrics that we can use to determine if that was successful. Funding will have to flow because, help like PSAs, like public service announcements, getting the word out, educating people will be really important. And then investing in all the other aspects. So back to like colleges and universities that the doctors have to flow through. Are we investing in that to make sure more people are attracted to the vision health sector so that we can put more doctors out into the market, and then research and rehab. I think that that's going to be one of the key areas that we're going to need to see happen. From an internal perspective, like Fighting Blindness Canada, we are creating, call it a project, but it's one of the biggest initiatives that we will have over the next 5 years. And it's to establish a referral path between the doctors and the patients. So when someone has a diagnosis, or maybe you already have a patient who's been diagnosed and now you're treating them, they should be aware that Fighting Blindness Canada is available to them. Truthfully, the referral path should be for all the vision organizations because there's a lot of work that we do together that complements each other. But for right now, what I would say is, in a perfect world, at a time of diagnosis, there would be some handoff to Fighting Blindness Canada, whether it's a pamphlet, a package, a QR code, a business card. So when your patient is ready to ask questions and have the conversation and show up at an event or meet other families facing the same diagnosis, they can turn to us. And then we can be there when, in a way that meets their needs at that time. So that would be a metric that is how many doctors do we have as part of this referral program? How many net new patients are being referred to us? And then which door are they coming through? Are they coming right to the education events? Are they calling our health information line? What is meaningful to them so that we can make sure that we're designing our programming in a way that's really valuable.
Right. That's a nice segue then into our last topic for our conversation about collaboration. Mm-hmm. So you've touched a little bit on that. But we know change happens when there's a loud, unified voice of many people joining together to express the need for change. Eye care is in need of attention in Ontario and across the country for change. And so partners need to collaborate to get a strong message across that everyone needs to look after their eyes. They need to go get their eyes checked, and that the healthcare system can and needs to do more to improve patient outcomes. So you've talked to, so there are layers and lots of different elements here, right? Have you... Or what kind of experience have you had in terms of encountering sort of an unexpected and particularly effective collaboration that moved something forward for you, like your mission within the organization?
Well, this is like the National Eye Care Strategy is such an easy example, but it's the most powerful example right now. I don't know of a lot of sectors where competitors would come together to band together and work with so little ego to do the right thing for the communities they serve. Most of the other sectors I've ever been in are a little more elbows up. But this sector has said each one of us plays an important role in vision health, and we all serve the same community. So let's work together. And I find that brilliant and beautiful all at the same time. And so that's the example I would use there. I would also very, selfishly like to say, our donors have really enabled a lot of innovation. So they have come together at different times over our history to say this is a particular area of research that we're really passionate about, and they will rally with us to raise money so that we can invest even more in restorative research, for example, or a certain type of eye disease research. That might be less common for others, but for this group, it's very important. And so that's where, the coming together of people with a common vision and a common purpose always, as you said, creates change. And that's really beautiful to see and be a part of and be able to be a catalyst for. And so you'll probably see a little bit more work out of Fighting Blindness Canada that does that.
Okay. Looking forward to that then,
me
right?
too.
So, how can optometrists best support and amplify the work that you're doing? So
the optometrists are such a critical player in the vision health space. We know, and we have great relationships with some optometrists across Canada, where they are such a trusted partner for Canadians, and we want to be a trusted partner for them, for the doctors and the patients. So I would encourage the optometrists who think that we could be of value to their patient experience. I know optometrists, they're busy, right? And they've got a lot of people that they want to help in a very short period of time. If they don't feel like they have the time or maybe even always the knowledge to be able to talk about the science behind the eye disease, what's happening, what that means for the individuals, a quality of life, level of independence, questions they should be considering, then we can take that responsibility off the doctor and be a partner in that moment. So I'd like the optometrists to think about how they can refer their patients to Fighting Blindness Canada when there's a diagnosis that might leave people asking for more information.
Okay. Thank you very much for that. Before we wrap up, was there anything else you're hoping that we would talk about that we haven't touched on yet?
One of the areas that is really important to us is having an inclusive experience for our community members. So we last year soft launched a new fundraising event that can operate across Canada. So any Canadian who wants to be part of supporting the work we do can participate in this event regardless of the town or the city that they live in. It's called Move for Sight. It's inclusive because it's about moving in a way that is comfortable for you. Like there are some people with extensive vision loss who maybe want to stay closer to their neighborhood. There are others who are still in earlier stages and they're willing to do something a little more aggressive or ambitious. Move for Sight allows people to move in the way that is comfortable for them. In Toronto, we're having an in-person event, June 22nd. And so it's both a fundraising event and it's an awareness event. It's about bringing your community together to really recognize how important it is to support each other in these difficult times and fundraise for Fighting Blindness Canada so we can invest in more research and more of the programming, the education, and the advocacy work we're doing on behalf of our community.
Jennifer, thank you so much for joining us today. It was wonderful, very informative, and it's fantastic to hear your experiences and such a wonderful leader and so impactful in the country. And thank you for what you're doing. So
thank you for giving me the platform to be able to talk about it. It's really exciting. We really love what we do. We believe in why we do it, and we're here to support the vision loss community. That is our primary purpose.
So if you like this episode, hit the like button, share a link, tell your friends, and most importantly, go get your eyes checked. As you've heard today, there are many conditions that don't show any symptoms, and it's important that you take care of yourself and find an optometrist. Go get your eyes checked, please. Thanks again for joining us today. Stay tuned. We have many other exciting episodes coming forward. Really appreciate you being here with me today. See you soon.